Well, thank you everybody for joining us today for our latest installment of EB Research Partnerships Community Council series. Today, we're very excited to be joined by Stuart and Erica, who are leaders in Chiesi's Global Rare Disease program, and they are responsible for patient advocacy and services at this incredible organization. You'll hear from Stuart and learn from Erica about patient advocacy at Chiesi and Chiesi Total Care, which is a personalized and comprehensive support program to guide you in getting started with their FDA-approved treatment, Filsavez. We'll save questions to the end and do our best to answer any questions that we get either via the chat and the Zoom at info@ebresearch.org or via social media. But please send your questions as we go on throughout the program, and we will answer as many as possible by the end of this webinar or after. Just to give you a quick update of what's going on at EB Research Partnership, 2023 was a very big year for EBRP and the EB community. We had a record-breaking year for dollars raised and research funded. We raised more than $8 million to fund 18 innovative research projects across 5 different countries. And most importantly, as many as you know, it was a big milestone of a year where we saw not only 1, but 2 FDA-approved treatments for the EB community. The first, Vyjuvek, is a topical gene therapy, and that approval came in May of 2023 for those battling DEB. And then Filsavez became the first approved treatment in the EU for EB in 2022, and the team at Chiesi fought to ensure access to this treatment in the US as well, and received that FDA approval for both DEB and JEB patients in December of 2023. So far, we've been off to a big start in 2024. EBRP continues to fund innovative and life-saving projects aimed at treating and curing EB. In 2024 alone, we have funded 10 projects totaling over $3 million across all subtypes of EB, as well as spanning gene therapy, stem cell therapy, cancer research, data technology, and more. We had some exciting events to kick off the year down in Nashville. Reporting for Duty raised more than $1 million, and we were joined by co-founder Eddie Vedder and some friends of EBRP and Post Malone, Warren Treaty, Jelly Roll, and others to have some music, as well as raising awareness and dollars for the EB community. Plunge Reality, I see our board member Emily Kubik is on the line, shattered their goals, raising more than $530,000 for EB research, as well as 20 locations from the East Coast of America to Japan and Australia and back, having thousands of participants across the country. We're very proud to have worked alongside the teams at Chiesi and what was formerly Amrit, who made Filsavez possible. And today we're joined by members of the Chiesi Global Rare Disease team, who are responsible for patient advocacy and services at this incredible organization. EBRP has a 5-year history of working with this team in partnership, and we thank them for their hard work to make this treatment approval process possible, as well as getting this treatment accessible to patients. You can see that everybody on their team is committed to bringing treatments like Filsavez to EB in the rare disease communities. They've been consistent supporters of our events like Venture into Cures and Plunge for Reality. And as you may have seen, Stuart and Andres on the call are not just doing the good work in their roles at Chiesi, but also are putting their bodies on the line and taking the plunge. So you can see some photos and a quote from Donald Murphy from the Amrit and Chiesi teams of actually springing into action and taking the plunge themselves. We know that the Chiesi team actually broke the record for the longest that they stayed in cold water in Ireland. You know, the way we do it in the US is we jump in cold water and we run out quickly and we get out of the water as quickly as possible. I don't know what they were trying to prove, but they stayed in the water for a long time, enjoying that cold before they got out. So thank you for the Chiesi team, not only for your support, but actually taking the plunge alongside us. A little bit about Chiesi. It's a family-owned and run certified B Corp committed to rare diseases. As a family business, Chiesi delivers innovative therapies and solutions for people affected by rare disease. Their goal is to ensure equal access so as many people as possible can experience the most fulfilling life possible. With perseverance and dedication, the Chiesi team collaborates with rare disease communities around the globe like ours to bring a voice to underserved people in the healthcare system. With grit, determination, and urgency, they are committed to moving obstacles to provide people affected by rare disease with the tools that they need. Chiesi Total Care is a resource to do exactly that. This team is designed to help patients using Filsavez and their healthcare providers. It's not just a brochure, but a personalized and comprehensive support program to guide you in getting started with Filsavez. We are very grateful and honored to have Erica and Stuart today with us to tell you more about Chiesi and Filsavez and how they can help. I want to start by giving bios of each before I pass it off to them, starting with Erica Strick is the Patient Services Director at Chiesi Global Rare Disease. She's responsible for building the Chiesi Total Care program at specialty pharmacies to ensure the patient community has access to these therapies. While Erica is new to the EB community, she is passionate about supporting rare disease patients and families and brings decades of experience to working across the pharmaceutical industry. Stuart Seiderman is the global head of patient advocacy at Chiesi Rare Diseases, where he's responsible for patient advocacy strategy and community engagement across the rare disease portfolio. He has more than 20 years of global advocacy experience, both in and outside of the biopharma industry. Stuart is also the co-founder and director of the Sanfilippo Research Foundation, a nonprofit dedicated to research in Sanfilippo syndrome and MPS III, a rare inherited lysosomal storage disorder of which his son, Benjamin, was a sufferer. Stuart is a rare dad who is committed to the EB and entire rare disease community. He's been a friend of the EB and EBRP community for many, many years. And we actually met in Wellesley, the original birthplace of Plunge for Elodie, where Stuart joined us in a plunge even before he had started work in the EB community. So we thank you for that. Stuart, it's an honor to have you both with us today. Just as a reminder, the questions will be addressed at the end, but please, as you're thinking of it, feel free to drop them in the chat or send us an email. We'll try to get to as many as possible. And again, if we can't today, we will be sure to follow up with you afterwards. Any questions that you think about afterwards or we don't get to today, please send them to info@ebresearch.org and we will route you to the best person to get you the best answer. Any resources and ways to get involved with EB Research Partnership, you can visit ebresearch.org and find lots of ways that you can support the community, from donating to starting your own event to signing up for monthly giving or helping us raise awareness for the EB community. With that, it is my pleasure to pass the Zoom mic over to you, Stuart.
Michael, thank you very much for that incredibly generous introduction. And you're right. As a resident in Wellesley, Massachusetts, I've known of EB through the Plunge for Elodie for years. I shouldn't think it's odd now, but after nearly 25 years in the rare disease space, these sort of small world connections no longer surprise me. And the fact that my family with a rare disease, Sanfilippo syndrome, and my son Benjamin and Elodie with EB both in the same town, both very active and promoting of our causes, brings us together at this moment. And we're greatly honored. The one thing I change in your introduction is the thanks are not to the Amrit and Chiesi teams for bringing these treatments forward. It's to yourself, EBRP, and the community who helped get us over the finish line. It would not be without the participation of the community in the clinical trials, in providing insights, in providing us the support and advocacy with the regulatory bodies that we could bring these treatments forward. And absolutely, it's our desire to make this as widely available to the community as possible. I'm going to pass in a few moments to my colleague Erica to talk about the patient support services around Filsavez in the United States. But you've already mentioned a few things about Chiesi and our advocacy team. We have a global team that is based in the US and Europe. We've grown now to 14 people and support our entire portfolio in the entire geography in the world. So our intent is to move beyond the US and Europe for Filsavez approval and bring this treatment to those that suffer from EB around the world. Chiesi, as you mentioned, is a private family-owned company. It's coming up on its 90th year. I and our rare disease team report to the grandson of the founder of Chiesi. And it's this combination of a family business, a commitment as a certified B Corp, which means that we put societal good on par with our financial results. We want to use the strength of a business as a force for good in the world. And we align with the UN sustainability goals. Most importantly, number 3, health for all. And this is the guiding light for us in the rare disease business, as well as in the advocacy function. And our job in advocacy is to work with yourself and the community because you are the experts, so that we can understand from you how to do a better job to support the community. It's one thing to bring a treatment forward. It's another thing to provide that broader holistic set of support. That's everything from what Erica is going to talk about, but also to raising the voices of the community, helping to close that gap that so often happens in the rare disease space where I feel alone. I've experienced this. Other members of the community on my team have done this as well. So we understand, and it's not just a motto for us, but it's our actions. And the one thing I would leave everybody with before passing to Erica is challenge us. If we are not providing the services and support, information, educational material that the community needs, let us know. And it's our job then to learn more and engage our partners internally and produce those things that are necessary. And yes, to show up and jump into the cold waters, whether it's in Wellesley or in Dublin or anywhere in the world from a team standpoint. So we are really very honored to be here, incredibly grateful to the community, and looking forward to a long-term engagement. So with that, I will pass to Erica.
Hi, hello everyone. First of all, thank you so much for letting me join this call today in this meeting. I'm very, very excited to be here. Also, thank you, Michael, for the introduction. I must say that in all my years of pharmacy, it has been a job until I started working with the rare disease community. That's when it truly became a passion. So I consider myself extremely lucky to have this role at Chiesi Global Rare Diseases, and I take it very, very seriously. So what I'm going to talk about today is what does it look like to get started with Filsavez, and what are the program support services that we provide through Chiesi Total Care. So Chiesi Total Care, what is it? A lot of people are probably asking. It's technically a one-stop resource for patient support. So the minute that first prescription comes in the door at our specialty pharmacy, throughout the lifetime of therapy for the patients, we are here to support you and to support the community. So Chiesi Total Care, as it called out on the screen, is a dedicated team of pharmacists, case managers. We work with patients and healthcare providers that utilize our Chiesi treatments. We have dedicated phone and fax numbers at our specialty pharmacies so that you don't just call in and get bounced around from one person to another person to figure out what's going on. It really is a one-stop shop. The pharmacy that we chose in the United States is Panther RX. This is a very, very special specialty pharmacy, I'll even say. They are truly focused on just rare disease medications. They have tons of accreditations across the board. And right now they're currently supporting 28 different rare disease products with patient populations ranging from 50 up to 5,000. So when we made the decision to use Panther, we really had a deep dive into how good are they. And we're very, very pleased with them. So I just want everybody to know that you're in great hands with the Panther RX team. So what are the support services? This is probably the biggest question in the room right now. So we really support with everything. So from program enrollment, the minute that you and your healthcare provider make the decision to start on this medication, as soon as that prescription comes into the pharmacy, we jump on it immediately. So we work through the enrollment form, which I'll show in a later screen, to make sure that we have all of the accurate information. We'll do a benefit verification with the insurance plans just to see what next steps are needed to get coverage for this product. I'm just going to kind of go down the list here because some of the other slides explain it a little better. but I just want to give you like an overall picture too. We do have a Chiesi funded copay assistance program for the medication, a patient assistance program if patients are uninsured or underinsured. Now, those two programs, there are different eligibility requirements. We can talk about those a little later as well. We have 24-hour dedicated pharmacist support because we know that just because our business hours are 7 a.m. to 7 p.m. Central Time, people live 24 hours a day. So should there be a question anytime outside of our business hours, you can call in and get in contact with one of the pharmacists. We also have dedicated nursing support. So at Chiesi Total Care, we do have a wound care certified nurse available to ask any questions that you may have. We have patient education support and then field reimbursement support. And this field reimbursement support is more of a role that works with your healthcare provider to help them with any insurance barriers that we might come across. So it's a very extremely vital role to help make sure that we get approval for the medication to dispense. And when I mentioned we are a dedicated care team, we really are. So it calls out on the bottom here, we have case managers, the reimbursement support, the wound care nurse, the registered pharmacist, the patient education support, but it doesn't stop there. We consider us a part of your care team. So we also work with patient advocacy. We work with the community organizations, and we work with the healthcare providers because truly the patient is in the middle of everything we do. It's not just Chiesi, it's all encompassing. We want to be part of that care team. So getting started. At the top here, you'll see we do have a ChiesiTotalCare.com website, and it does list all of our current products in the United States. So what I kind of have here is like a next step or a step-by-step process of where to go to look for this information. So you can see, I don't know why I reached for the mouse to move or anything, but there's two tabs there. One is healthcare professionals and one is patients and caregivers on the left-hand side. And if you click the patient and caregiver, then click Filsavez that's highlighted, it'll open up the website that's dedicated to Filsavez. So on the right-hand side with that picture, it talks a little bit, it gives you some more information on Chiesi Total Care, but then there's also the option to go ahead and enroll in the program. So for the healthcare provider section, there's also going to be the prescription RX order form, but then it's also the option to enroll into the program. And I'll talk a little bit more about what that means to enroll into Chiesi Total Care. So these are the two forms that are required. So on the left-hand side is the prescription form. And this prescription form needs to be completed by your healthcare provider and submitted to Chiesi Total Care at the pharmacy to really kick everything off. It's just like any other prescription that you see. It has all the demographic information, diagnosis information, the actual dosage for the medication that the doctor prescribes. On the right-hand side is the patient enrollment form. This is kind of what you probably heard at other companies maybe call a consent form, but this patient enrollment form is basically your team, you guys telling us, yes, I do want all of the potential services available through Chiesi Total Care. It needs to be completed by the patient or the caregiver and submitted to Chiesi Total Care. And this is the form that will allow access to the additional Chiesi sponsored financial support programs that patient might be eligible for. It doesn't have to be completed, but in order to get the additional benefits of the program, we do need to have that on file. So I'm going to go a little bit through the journey of what it looks like once that prescription is received. So once that prescription is received at the specialty pharmacy, we have dedicated care coordinators. Sometimes they're called case managers, sometimes they're called patient service coordinators, but at Panther and at Chiesi Total Care, they're care coordinators. So once they receive that prescription, they will be reaching out to you within 24 hours to let you know, hey, great news. We just received a prescription for Filsavez from Dr. Bob Smith. Let me tell you a little bit about Chiesi Total Care and what to expect with next steps. They'll create your account in their system so that they can monitor and keep track of everything going on. And then they'll also reach back to the healthcare provider and just confirm receipt to let them know, hey, thank you for submitting this. These are the next steps involved in getting patients access to therapy. This will be your main point of contact throughout the life of the program. Again, I mentioned it earlier, we don't have one person you talk to for copay assistance, one person you have to talk to about the prescription, one person you have to talk to about refills. We really want to make it as easy as possible to where all we really need from you is to pick up the phone when we call. We want to make sure that we're taking on the headaches if there's any along this journey, so that you don't have to experience any stress through the process. So as soon as that welcome call is complete and all the insurance information is received, as I mentioned, Chiesi Total Care will complete a benefit verification with your insurance plan to determine what needs to be completed for your insurance to cover the medication. You guys might have heard this terminology, prior authorization. Prior authorizations are just an additional step that a lot of insurance companies require just to prove that you do really qualify and need the medication. So what Chiesi Total Care will do is we'll capture all of the steps, all of the requirements for the prior authorization process, and we'll support the healthcare provider in submitting that PA. If it gets denied, we'll help that provider with an appeal. We're there every step of the way to get the product covered. And we do advocate for patients when it comes to the insurance companies. Chiesi Total Care will then provide you with any information regarding the different copay assistance programs available. There's a couple options out there depending on the type of insurance coverage you have. And then of course, if there is no insurance coverage, or if the insurance plan says, absolutely not, we're not going to cover this product for whatever reason, then we do have a patient assistance program that we can work with you on. So patient scheduling. So once we have all of the authorizations in place, everything is good to go, we'll go ahead and schedule the shipment. Now we do have some additional support, like I mentioned. We do have the wound care nurse at Chiesi Total Care. And what they'll do is they can provide additional education to address how to properly apply the medication as well as storage of the medication, and just answer any questions you might have about the treatment. We have registered pharmacists on staff, of course, because we are a specialty pharmacy, and they will provide the pharmacist counseling on the medication prior to the first treatment and educate on any potential side effects or answer any questions you have about potential side effects. One thing I do want to call out with the wound care nurse also is they'll have a set outreach based on your preference on when you want them to connect with you. So typically about a week after the first shipment goes out, they will call you and they'll say, hey, how's it going? Do you have any questions after you've started using the product? Because we all know that, this is a heavy and fast journey to get the product in your hands, and you might not think of questions until after you start utilizing it. So this nurse will set up that cadence with you to determine what type of outreach do you prefer. We're there again through the total therapy journey, not just getting you on the medication. We do ship medication typically via FedEx Priority Overnight. If Priority Overnight is not preferred, we can do 2-day delivery. We do require an adult signature for the delivery of the product, but the Chiesi Total Care Team will reach out to you prior. It's usually about 7 days before your next refill is due to find out what date, what time works better for you, because we're going to work around your schedule. So that's an outreach that you'll be hearing. We can ship to any location in the United States for convenience. So if you happen to be at grandma's house in California, as opposed to your home in New York, we can ship the product to grandma's house in California. That's something else that we'll confirm during that refill coordination call. What date is best, what time is best, and where do you need the product delivered? And then this shipment is tracked by Chiesi Total Care throughout the process. In case something pops up, you happen to not be there when you schedule the shipment, we can work with FedEx to make sure it's delivered the next day. Or if we need, again, to change the location somewhere else, we'll do everything in our power to get the product in your hand. And then it's not just, again, it's not about just getting product to you. It's up, how do we support you throughout your journey? So even after that first shipment goes out, I kind of touched on it a little bit. There'll always be that ongoing clinical navigation. That dedicated wound care nurse will always be there to support you. The pharmacy team will always be there to support you. Continued insurance support, should you change insurance plans after starting the product. We'll kind of go back and start that benefit verification process over. And again, work with the healthcare providers to make sure that there's access to drug. You'll always have that dedicated care coordinator. so that if anything pops up, you can call and speak to them. I can honestly tell you that when I started in specialty pharmacy for rare disease, I was a dedicated care coordinator, and it's amazing the relationship that you can build with this person. I get emotional when I think about it, but I remember calls when new babies were born, calls when, hey, I just got engaged, I'm getting married. You know, it's really such a valuable support person to have there for you. We also have digital patient resources. So we know that not everybody likes to talk on the phone. Not everybody likes to text. Not everybody likes to email. We can do all three. So it's whatever you prefer, we will meet you there. As far as the enrollment forms, we can send those via DocuSign to make it a little easier to sign those and get those returned. We are currently working on a way to enroll electronically. I'll be honest, that's probably not going to be available till, what month is it, July? Probably not until around September, but we're constantly even making improvements in these programs to make everything easier for the community. And that is the bulk of it. But again, I know I can't see the chat, but I'm sure there's a lot of questions that have popped up to get a little more in depth. We do support all insurance types. So whether it's Medicaid, Medicare, commercial insurance, like private insurance through an employer, TRICARE through the government. That's where the differences kind of come into play with the support, the financial support programs we can provide. But if you have any questions, feel free to ask.
Great. Thank you, Erica, and thank you, Stuart. I was reflecting, listening to you both speak, and again, just wanted to thank you for your perseverance. I mean, Chiesi is a rarity of a biotech or pharma that's been around for almost a century, right? And rare disease really being in your DNA as a family organization, but as somebody that's been committed for that long to the community. I remember when you all were going through the process of EMA approvals and FDA, and it wasn't an easy process. And I see there's some names on this call of families that stood with Chiesi and Amrit at the time to really advocate, right, and help educate the FDA. So to see it at this point of not only an approval but a full access program to help patients be connected with you guys as an organization, but particularly this therapeutic is remarkable to see. So I know it was a long journey, but you all never gave up, and I think that's part of your culture as well. And a significant milestone to have 2 FDA approvals last year, but for you all and Filucivez not only to be an approval for a dystrophic EB, but the first ever for junctional was a big relief to that community, because once Vyjuvek was approved, we heard a lot of that, right? And this is great and exciting, but what about junctional? We have some questions rolling in, and I'm going to start to go through those, assuming that's okay with you, Erica and Stuart. Just again, a reminder to those on the call, you can raise your hand. I see some great families with a lot of knowledge. So whether it's a question or even a comment, those are welcome as well. Feel free to raise your digital hand, drop it in the chat, and again, or email it afterwards. The first question that we have for you, Stuart and Erica, is the question says, in order to start the process and get the prescription, does a family need to work with an academic medical center or a major university to start the process of getting Filucivez prescribed, or can they work with their local dermatologist?
We can accept prescriptions from both, regardless of whether it's a KOL at an academic university or your local dermatology office in your hometown. That doesn't matter to us at Chiesi Total Care. We can support both.
That's
More of
fantastic.
a decision between you and your provider, especially if you have both, to determine who's going to pick up and take on the ownage.
That's great. And a huge benefit for those that don't have access
Right.
in proximity of a major academic medical center. The next question that we received is understanding that this is approved for DEB and JEB. Are junctional patients with non-Hurlitz and Hurlitz eligible for Filucivez?
Junctional,
So-
yes.
Yeah, so I'm going to slightly defer that question to, it's when you start to get into some of the very specifics here, I want to remind everybody that Erica and I are not
Doctors.
medical professionals. We represent the patient services and the advocacy function. And really, these are questions for your individual physician, dermatologist that's working with either yourself or your loved one. But yes, Michael, the approval is for both Deb and Jeb for individuals 6 months or older.
Yeah.
Okay, great. Thank you both. Appreciate that clarification. The next question we have is, how do you all see this being a complementary therapeutic to Vyjuvek for those patients with DEB?
So we can't speak to Vyjuvek specifically, but there is nothing in the label that limits the use with other medications. And again, that's a question that's up to the individual treating physician.
Perfect. Thank you. The next question that we have is, do you guys have a sense of what this would cost if an individual doesn't have private insurance?
Do you want to take that, Stuart, or do you want it?
No, you can take that, Erica.
Okay, so private insurance, I assume by private insurance, do you mean like a commercial insurance through your health, your employer? Or do you mean just any type of insurance coverage?
They didn't specify in the question,
Okay.
Erica, but I'm going to assume private insurance via the employer.
Okay, so we do, like I said, we support Medicaid, Medicare, but the cost of the drug is really going to depend on your insurance plan and what level of formulary that drug falls on. So that's a decision made by your insurance plan. So we have no control over what the copay amount would be with the insurance company, but that's why we've created the copay assistance program where we can help patients with commercial insurance plans. There's also a 501c3 foundation and organization out there that's separate from Chiesi and Chiesi Total Care that provides copay assistance and financial assistance for patients with the Medicaid or Medicare plans. But yeah, that final cost is really, it's determined by the insurance.
That's helpful. And, as you kind of walk through too, Erica, that's something that the Total Care program is very willing to help people navigate, right? And I think you even mentioned in your speaking points, in some cases that may even include helping people navigate to a different insurance provider as well. So,
Yeah.
I mean, that's a great place where it sounds like Total Care can help with that. One question we have that you both covered a little bit in your notes, but how often should Filsavez be applied, and is part of the prescription to apply over the full body or just wounds that are affected?
So again, this is something that's in the realm of the treating physician, but there is a website, filsavez.com, that has links to the full prescribing information as well as how to apply the product.
Yeah,
And again, that's also something that from a Chiesi Total Care, and maybe I jumped in on top of Erica, the different support functions within that, such as the nurse and the wound care support, can help individual patients with.
Yep, I was going to say that's definitely a decision from your healthcare provider and the prescriber of the medication, how often they want you to apply it, where they want you to apply it. That needs to be determined by the physician.
Great. And I just saw Amani dropped in the chat where people can go to navigate through some of those resources, including
Thank you, Amani.
the Total Care website as well. As we're kind of taking in a few more questions from online, is there anybody on the call that would like to ask any questions or provide any comments to the team while we have them here with us?
I actually have a question, and I'm not sure Erica or Stuart who would be most appropriate, but I'm wondering if you feel like you've gotten feedback from the patient community about what they found most useful, like what piece of the service that you feel like they're really leaning into the most, and did that surprise you? Was that like on track with kind of what you thought before the program rolled out?
Erica, I'm going to defer that to you.
I haven't. So I personally don't get to speak to patients and caregivers directly. That's all through the specialty pharmacy team, the Chiesi Total Care Team. I've heard some positive feedback about the level of outreach from the team and the level of support, feeling that they are truly supported throughout this process, because anytime you start a new medication, especially if you're not used to a specialty therapy that you can get from just one pharmacy in the United States, it can be terrifying. So I've heard a lot of feedback that they really felt like they were supported throughout the process. As far as the HCP community, I don't know if there's any HCP members on the call. I've heard a lot of feedback about the support through the reimbursement process, how we're really, I don't want to say hand-holding because that has a negative connotation, but we're really there every step of the way. So should something pop up, they don't understand what the insurance is asking for, our team can jump in and kind of liaise between the two and figure out what the path forward is. But I haven't been able to speak to a lot of the community directly, if that helps at all.
That's super helpful.
Yeah, I would also say that we do randomly survey members that are part of the program, and our experience from some of the other therapeutics that we have out there, understanding that Filsavez is still very new to the community and to our delivery pathway. We have heard that one of the most useful aspects is that insurance navigation support. And I
Insurance.
see we have somebody online who would like to ask a question.
Yeah, the world famous Mr. Kirk, an amazing, heroic dad, motivator and inspiration for us, and just a great ambassador out there in the community. So we will always give you the floor, Mr. Kirk.
I think you're too generous with that, Michael. Thank you, though. So just we all know and understand, but in our perspective, the give and take battle that we have as individual insurances. And my wife and I were very fortunate on our end that our insurance has allowed us, after many different battles, to get ourselves and get our son the ability to receive medications. Are there any guidelines, and I know you spoke about it through your program as far as the insurance support model, but are there any guidelines? I mean, this is a question that we see consistently throughout the EB community, where the denial and then the reapplication and the denial and the insurance process of getting there. Are there any things that you have seen that may be more fruitful than, okay, we know we're going through this and it's been prescribed, but we almost kind of expect a denial, and then we have to go back and fight and appeal and then go back and fight and appeal? Have you come across anything that we can maybe use, or advice that we can kind of get that information through that may allow us to bypass the 3-4 weeks, 3 months it takes for insurance providers to come back and finally give us a emergency approval, or things that we've gone through?
Yeah, I think the big key there is to make sure that the healthcare provider is providing all of the information, all of the different issues that, maybe the patient has faced, if there's been infections, just a full picture of the whole medical profile. I think it's also beneficial, honestly, if it's possible, to submit maybe pictures of the wounds, because let's face it, a lot of the times when we're working with these insurance companies, it's somebody that is just supposed to say no. They're supposed to look through everything and automatically deny it, and then let somebody else fight it. So I think if you have the compelling story for, we absolutely need this therapy, for this patient for this reason, I think that helps. We're always gonna have a plan that's, I gotta watch my words, a little harder to work with, a little more difficult to work with than others. But again, let us take on a lot of that burden. Let us take that at Chiesi Total Care. So like I mentioned, we do support through the full PA appeal process. We also have a path forward, because we have sadly seen this happen, where a healthcare provider's like, I don't even want to do it anymore. I'm done fighting. We have the ability at Chiesi Total Care, with some additional consents from the patient and the family, to do the appeal on the patient's behalf. So with most of the insurance companies, you have an HCP level of appeal, but you also have that patient level of appeal. So we can jump in and help fight for you. Again, there's additional consents required, because we're kind of doing the work for you. So we have to prove to the insurance that you're okay with that. But that's kind of the way that we get around it. We've been pretty successful So far, it's always difficult with a brand new drug to market because insurance plans will load it into their system on their set time frame. But we do have additional safety net programs, if you will, to try to kind of provide product while we're doing some of these battles. And I think that's a fair term of battle with the insurance plans.
Yeah,
Thank
something
you.
else I would add is this is where, Michael, you and your team can also help. If you're hearing from community members that there's a particular insurance carrier that is posing a lot of difficulties, we have a large team behind what Erica has shared in Chiesi Total Care, the advocacy team that you see here. We have an entire market access team that will work with individual insurance carriers and try to get those barriers lowered as quickly as possible.
Yeah, and when we hire people for Chiesi Total Care, because I do get to be part of that process, to be honest, I hire bulldogs. When I was at Chiesi Total Care prior to joining Chiesi, I can remember 3-hour phone calls where I'm like, no, you're not going to tell me no. The patient needs this. The healthcare provider prescribed this. What is going on? And just saying, I need to talk to somebody else. Let me talk to your supervisor. Let me talk to their supervisor. You know, it's like, we don't just, we really, I'm honest when I say we really fight to help patients. And that's what I'm very proud of.
Thank you.
Yeah.
Can I ask one additional question on that, just of the
Yeah.
two of you? So have you seen, and again, brand new drug, especially experimental in what, not just PRN's local, something that's brand new. Have you noticed that insurance providers in particular are giving more friction? Let's say, given in our case particular, our son is on Bijuvic, and now we go for their application process and he's already on Bijuvic. We're an insurance company saying, wait, you're already doing this. Why are you trying this? And given the nature of our son with DEB, the amount of medicines we take and the battles that we fight with our insurance companies just to get even simple coverage or help or assistance in coverage. Have you noticed or have you come across anything that insurance companies are kind of saying, well, it's kind of a one or another, or is it an opportunity that way? Or have they been pretty receptive about that, just in your experience?
I have not seen any denials come through for that reason. I'm not saying we won't somewhere down the road, but again, that's where our reimbursement team at Chiesi, our national account team, they can take the PI, the prescribing information. They can take information, from our medical team and say there's no reason per our label that this can't be utilized if the healthcare provider makes that decision. And they can kind of fight it that way behind the scenes.
And I think it also goes back to what Erica said before about what are best practices to make this as smooth a process as possible. And that's to have the physician, note the differences in how the two medications work and can be applied. Our Filsavez is something that can be done at home, doesn't have the same types of doesn't have any area limitations or frequency. So for the prescribing physician to point out why this is being prescribed in addition to another medication is also going to go a long way in helping to move past that barrier.
Thank you both very much.
Yeah, thank you.
Thank you, Kirk. And Stuart alluded to this as well, but that's something that we're always happy to help with too, Kirk. Probably, unfortunately, we've had to send those letters too many times. Fortunately, it doesn't take us long to prepare them. And a lot of times, and you mentioned this, Erica, it's reminding some of these providers the unmet need and the reality of what EB is. So again, something we're always happy to help with, and I know stuff that we've talked about too, Kirk. So, but thank you for both of those questions. Really helpful for the whole group. Trish, another just heroic, amazing person. And again, just another really incredible ambassador in the community. So over to you, Trish.
Good morning. My question, or actually not a question, kind of a suggestion that I have found helpful having two kids with recessive dystrophic EB. Just lately, we had a new insurance company that was really giving us an awful time. And we use a university hospital. So most of them have a complex care team at the hospitals, so that if there's, you know, patients who have really complex medical needs, and they literally will go, they will do jump hoops and quickly anything that a person needs. So one person to contact if you have a family is the complex care team at the university where you're being seen. The other thing that has been very helpful to have these kind of prescriptions gotten very, very quickly is actually applying for a complex care coordinator within your insurance company. Just having like one person that they know you, you knew them. They do like, you know, weekly calls with you to make sure everything's okay. They send through, you know, the prior auths. They talk with the doctors. They're like the middle people that make things happen very quickly. So those two things have really helped us, you know, get things approved within like days or weeks.
And that was a complex care coordinator at the actual insurance plan?
Yes, both.
That's
So
amazing.
you can apply for a complex coordinator at the insurance plan for private insurance. I imagine there's one for Medicaid too, but also the complex care team at the university or the hospital where you're being seen.
I've heard of them at the hospitals and your academic centers, but I didn't know the insurance did that. That's amazing. See, this is another reason I love these calls. Not only do I get to connect with the community, but I learn something every single time. So that's great advice.
Yep, the one person to handle all of your issues. So thank you.
Thank you, Trish. Yeah, thank you for honestly that tip, Trish. And for those that don't know, Trish is just a amazing resource and wealth of information and wisdom. So thank you for that. Really, really, really helpful. Just getting another question from the group, and Eric and Stuart, realize you may or may not be able to answer this one, but I'm the messenger on this one. Are there any plans to expand into simplex or other therapeutics in addition to Filsipez?
Yeah, so thank you. Great question. We don't have a program right now for simplex, but we do have what we call life cycle management, and we have earlier stage programs that are for different applications in the EB space. We're still working on that. Those are in a preclinical, so they're not imminent, but this is once Chiesi gets involved with a specific disease area in the rare space, we're constantly looking for how do we expand and enhance the use of not only the approved medication, but what is the follow-on? What's the next thing? There's no guarantees. Only 1 in 10 programs makes it to approval, so we don't have a great crystal ball for the future. But I can tell you that we are working on next generation and trying to expand labels where we possibly can.
Great. Very helpful, Stuart. Thank you. Another question that we just received via Total Care is are you usually assigned for one specific person, or is it a team that's available to you? The question is 24/7, but as I'm sure you both know, these questions can come up from families at all hours of the day and night. So a very specific question there, but a good one.
Yeah, there's 24-hour access to the pharmacist, not the full care team. And it is a full care team. So when I say dedicated case coordinator, yes, we do want you to have that main point of contact that you get comfortable with, so that you can reach out with anything. But it's almost like it's layered. There's additional reimbursement team members behind the scene working on complex cases. The pharmacist team, the wound care nurse team. You know, there's a whole team there. We do build in redundancies because, of course, we have to let people take time off of work for vacations or sick time. So I can't confirm that every time you call in, you're going to get to talk to Susan. You know, she might be off. But since it is a team behind there, they all have access to the system that I'll say patient case or patient file is in, so that anybody that answers the phone can pick up and help. So probably was misleading with the one person because it is a full team. But again, it goes back to building that relationship of trust with somebody at your specialty pharmacy program at Chiesi Total Care.
Excellent. Thank you, Erica. Another very specific but practical question. Does the product require refrigeration, or is there a limit on the amount of time that it can be stored and kept?
I would have to look that up, to be honest. Pretty sure no refrigeration is required because I think that Yeah,
No
that's not
refrigeration is
required.
required, but there are environmental extremes you want to stay away from.
Yeah.
Obviously, freezing in high heat, and for some of us, depending upon where you're located right now, we're in the upper 90s and such. So this is not something you want to leave out in that type of weather, but yeah, there's not a special um, climate control that's required.
Yeah, and again, that's something that the team at Chiesi Total Care will talk to everyone about when you start those initial phone calls. You know, what does the storage look like? How do I manage this product specifically? Can I travel with it? You know, those are all questions that the team at Chiesi Total Care can answer. And again, that's one of the reasons that when we schedule the shipments, we make sure that it's a time that works for you. Because like Stuart mentioned, it's incredibly hot in most of the country right now. So we don't want the product shipped and be setting anywhere and have potential damage to it. So that's kind of, we're always working around the refills based on your availability and what works best for you.
Great, thank you, Erica. Another question regarding the dedicated nursing support provided by the Chiesi Total Care Program. Do they only provide support on Filsavez, or are they a resource we can utilize for general EB care questions? It was a good question.
General EB care questions. Yeah, that's why they're trained and educated on EB so that they can answer any of those questions. Now, since it is a nurse, not at your healthcare provider, certain things they will refer you back to your healthcare provider for. Like if you want to change the amount of time or the amount of times you change your dressing. If you want to make any modifications in your care or your prescription, they will refer you back to your prescriber to have those conversations. But yes, they're educated on EB to answer any questions about the disease state.
That's really great to know, Erica, even beyond Filsavez, that there's support going through Chiesi Total Care, which again, I think probably speaks to the long history you all have had with the rare disease community. I know we're coming up on time, and I see a few more questions coming in. I do just want to pause because I know we have a great group of families on the line. If there's anybody that wants to ask a question in real time, please just raise your hand. And as we kind of come to a wrap and see if any more questions funnel in, Eric and Stuart, my question to you, is there anything that we didn't cover today, or anything you would really like the community to know that we haven't covered so far?
Sure. So thank you, Michael. And again, thank everybody for their attention on this and participation. The last slide that Erica had put up was a group of contact information. By all means, the top website is our rare disease business. You can learn more about Chiesi and the various programs that we have. The middle is our patient advocacy team. We love to hear from people individually. One of the things that we very much want to do is raise the voice of the community. So if anyone is interested in sharing the story, the challenges, the triumphs, whatever it might be, we're happy to work with you to bring that forward. And then obviously what Erica's been talking about is the Chiesi Total Care Program and the contact there.
Yeah, and I think my thing would be, because I know I threw a lot of information out. It's really hard to give a full encompassing picture of what it could look like on a quick Zoom call. I urge you to go to chiesitotalcare.com, go to the Filsavez page, and just look through everything. There's lots of additional terms and conditions in regards to some of the financial support programs, the different levels of support provided, different types of support. And if there's something that you think we're missing, let us know. You know, again, Stuart called it out at the beginning of the call. You guys are the experts in this disease state. If we're missing something, we can only improve with your feedback. And it's always welcome. Good, bad, ugly, I don't care. Let us know if there's something else that we can change or maybe add to the program. And then I'll look into that on my side and make sure we can do it compliantly. But please share your feedback, because that's the only way we can get better and make sure that you have everything you need.
Fantastic. Well, Stuart and Eric, I want to thank you both, not only for the determination and resiliency to get this treatment approved, but knowing how difficult that is, it really starts the hard work from there, right? And the work you've done is remarkable to get to this point and provide resources to the patient community in addition to the treatment itself. So I thank you. I just want to underline your ethos of Chiesi that you both have embodied today. Tell us what's working, but tell us what's not working. Tell us how we can improve. Tell us how we can meet your needs better is just such an important message. So again, contact information here for Total Care and the advocacy team. As we mentioned, if we didn't get to one of your questions today, or I know it happens to me all the time, you think of something after this call, please send us a message at info@ebresearch.org, and we'll make sure to route that to the best members of the Chiesi team and get back to you as quickly as possible. Thank you again, Stuart and Erica, from your time. We know you are very busy doing this across the country, so we appreciate you making time for us in the community today. In conclusion, I see my friend Hodges is on the line, so I just wanted to take the moment to plug EB Lifestyle. If there's anybody that's not familiar with it, it's an amazing organization that Hodges has started and co-founded. Please follow what they do. They make mobility devices available to those in the EB community that need it. We're a proud supporter, and Hodges is the person that you want to know, and you want to be in every room that he's with. And so you can get T-shirts and clothing and wear it proudly to show your support for the EB community. There he is. Hey, Hodges, anything I missed, Hodges? You can talk about EB Lifestyle better than me.
No, thank you so much for the shout out. Can y'all hear me?
Yes.
Okay, yeah. No, just getting ready for the Deborah conference. So I'm out and about. So stop by the booth if you have any questions. But we really focus on the mobility aspect of EV. So we focus on donating lightweight portable mobility wheelchairs and scooters to the EV community.
Yeah, Hodges, I was lucky enough to meet you last fall at the Patient and Family Conference, the Deborah Conference. So it's a pleasure to see you again.
Yes, definitely. And I signed up for the Chelsea. It's the panel on Monday, I think, at the
Okay,
Deborah conference that you're having. So I'll see you. Hopefully.
awesome, great. I look forward to
Yeah,
that.
yeah. It'll be a good time.
Thank you, Hodges. Hodges says he's out and about currently. Hodges, you're always out and about. We can't keep track of you, but Hodges, for decades now, has been such a great ambassador in the EB community, and particularly even for the junctional community. So thank you, Hodges. Wanted to give you that shout out, and thank you for making time in your busy schedule, sir, to be here with us. So check out EB Lifestyle. And as a reminder, ebresearch.org, lots of exciting events coming up, ways to get involved, to support, donate, to continue to support record-setting progress to fund research, life-saving therapeutics around the planet. So you can join our monthly giving program. You can start your own event. Things like Plunge Reality started with a small group of people in Wellesley and your community, Stuart, and expanded into global initiatives. Can be as simple as a lemonade stand in your backyard or putting the fund in fundraising. What does your community like to do? We've got an event for those in the Northeast coming up in September, some live music and a music concert and show for EB at the Cutting Room, an iconic venue in New York City, and lots of events throughout the fall. So please stay in touch, sign up for the newsletter. We'll see you at the next community council, and I'm sure before, but thank you everybody for joining us and making time today, and we will see you soon.